All right, at this time, we do not have a proclamation, but we do have a presentation that we would like to be presented today concerning a project that's going to be coming here in Gadsden. So, Mr. Hooks, if you'll come, and then you can make the introductions.
Thank you, Madam President. This is a follow-up to a presentation that we brought to you, the council, 2 weeks ago in pre-council. It's proceeded far enough along now that it's the appropriate time to bring it to the public. As you know, 2 years ago, we interjected healthcare as an industrial sector as one of our targeted industries. This is one of the first major projects that we've had that falls under those categories. And we have with us today Mr. Keith Whitley, Mr. Tim Coker, and Ms. Susan Moore. Susan is with Riverview. Tim Coker's with CPM, and Mr. Whitley is with Cancer Centers of Alabama. And I'm going to turn it over to Mr. Whitley to make the presentation. Thank you, Madam President.
Thank you, David. I'm Keith Whitley, and I'm the CEO of Alabama Cancer Care Centers of Alabama. And we're here to make a presentation and hopefully secure and purchase a piece of property that the city owns that would work very, very well for our proposed cancer treatment center. We would like to build a freestanding cancer center to include radiation and chemotherapy for the community here in Etowah County. We've identified that several market reports indicate that a large number of people who live in the community are driving to other larger markets for their cancer care, and we just think that's unnecessary. We have previously worked with cities that have had similar situations, and we've helped keep patients in those communities, and we think we can do the same thing here in the Gadsden area. Patients having to drive to Birmingham or Atlanta or Chattanooga or up to Huntsville to receive cancer care is it's very, very difficult on the family, certainly difficult on the patient. But our project, our cancer treatment center, is a drive up, get out, come in, receive your chemotherapy or your radiation, get back in your car, get home. Get back to your family, get back to your support system that works well for you. We've been doing this since 1996. We have other locations in the state, and we think we can be a really good community member for Gadsden. Our intent is we'll bring people, professionals here to this cancer treatment center. General information, it will have a personnel budget of between $3 and $3.5 million to include the physicians. The building, to include the equipment, is going to be in the neighborhood of $6 million. And then we will have an ongoing presence here. We are a local Alabama-owned, Alabama-focused company. We will hire local subs to work on the building. We'll work with the community leaders to make it have a positive impact on the community. From the parcel that we're talking about is a beautiful tract. It'll make a beautiful site for patients who have to go through getting cancer treatment, to make it a more pleasing place for them to receive the cancer care. It's just I think it'll work well for all. I can answer questions from the council about what our intent is, but that's the thesis.
You had said that you've done this in, I think, 11 other cities in Alabama since the 90s?
We have 10 of these cancer treatment centers scattered from central Alabama to north Alabama. We're in Fort Payne, Sylacauga, smaller markets is where we started. And not that Gadsden is a small market, but it works well in that we have patients who get up and have to drive to Fort Payne, or they can drive to Gadsden, or they can drive to Anniston, and that just makes all the difference in the world.
You had mentioned a relationship with UAB about some of the clinical trials that you're involved with.
We work with UAB. It's our state institution. We truly support what they're all about. For those patients who typically would have to drive to UAB to participate in some clinical trials, we work in a hand-holding relationship with them such that the patient can actually receive their treatment and or their drug therapy in our cancer center under the guides of the UAB trial.
I guess in the last question or comment, I like your commitment to the aesthetics. This is not a medical comment, but Councilman Wilson had brought up a good point. It's valuable land on the river. You have a commitment to the aesthetics for our city to be complementary of the river and the opportunity that's
Right.
afforded there from the outside looking in.
We'd like for Mr. Coker to come and sort of tell us about the structure.
Yes, specifically addressing the design of the building, what you're seeing now is the front of the building. That should be the westward facing, and it'll face First Street. The eastern face that'll face the window is proposed, that'll face the river is proposed with a pretty expansive series of windows there to allow, that's where the medical oncology component of the treatment will be. Patients will have view and potentially an accessible plaza deck area toward the river to utilize that for just the healing experience of the patients. It'll be every bit the back. There's not really a rear to this building. It'll have two very well designed and decorated elevations, facades.
Okay.
What questions?
Just to give the layout in layman's terms for the average citizen out there. So this is essentially right next door to the old convention hall on First, right there. And the building, the technical front of the building will face that big parking lot across from convention hall, essentially. And then the back side of the building, for lack of a better term here, that would be facing the water up on that hill where the existing parking lot is, will be glass, and there'll be an opportunity to have sitting areas and things out there so that it overlooks the waterway. So if you're driving down Rainbow Drive and you're looking up past the monument there, you would see the glass structure of this facility overlooking the water there.
Mr. Whitley, just to kind of touch on and piggyback on a point you made earlier, you pointed out the fact that people will now have the ability to, without having to commute to a larger market, patients from Gadsden would now be able to get their treatment here. But you also talked about there being no drop-off in the quality of care. That
Right.
You want to
Sure.
reiterate that?
Absolutely. Yeah, with the amount of time that it'll take to get the building built, we have plenty of time to continue to look at what we believe will be the response to a potential cancer center. We have ordered the latest version of the machine that's necessary to give radiation. It's called a linear accelerator. But with time, there may be some things that we need to identify that as add-on to contribute to this to the needs of the community. So it's cutting-edge technology, cutting-edge chemotherapy, and participation in clinical trials. So the things that we would not participate in would be the things that typically an intermediate market may not participate in, and seek out the relationship with UAB to get the best results.
And as you said earlier, about the program that you have, because
Right.
when I stated, we have 27, 28% people live in poverty. So that is great. I was sold before, but I'm really excited now.
Thank you. Thank you. Yeah, we realized when we made the decision in '95 to enter into this particular market, the smaller markets, that we would have to tackle the problem of how we're going to get all those patients treated and because we didn't want to turn anyone away. So we have put in place indigent programs, relationships with pharmacology companies to help subsidize those needs. It just takes us a little while to get those patients entered into those programs. But if you come in our door, we're going to figure out a way to get you treated.
Thank you.
To Mr. Hooks and to Mr. Green, we just want, healthcare is a very essential thing for all of us, and it affects all of us. And so what I'd like to say is that I appreciate that you all saw the need and continue to see the need to bring health care to the city of Gadsden. Not only does it bring jobs to the city of Gadsden, but it's also a way of helping people with their health care and to have a better life. And so we thank you for what you're doing. This is a great, great project that's coming to Gadsden. And so I hope that people will see it as a positive